A very good morning to all of you. Today we have a video demonstration on posterior abdominal wall, lumbar plexus and diaphragm. Okay, so we'll begin with the video demonstration from the posterior abdominal wall. As you can see over here, we have removed all the viscera, which was like kidney, suprarenal gland. Over here were intestine, small as well as large. Now what we can see in the wall, posterior abdominal wall, two large structures. One is on the right side is inferior vena cava, and then we have in the cavity is the abdominal aorta. This one is the abdominal aorta, and it is showing a few branches. Over here, this one is the celiac trunk, superior mesenteric artery and inferior mesenteric artery, and ultimately it is terminating into right and left common iliac arteries. Okay, now near to this on the right side we have a formation of inferior vena cava from, this is occurring at the level of body of L5 vertebra. So right and left, this one is the right common iliac vein, left common iliac vein, they will join to form inferior vena cava. Fine, this is right gonadal vein which will finally drain into the inferior vena cava. Over here, these are the tributaries of left renal vein and right renal vein. We have cut already for your ease purpose. Now moving to the muscles of posterior abdominal wall, which we studied in the lecture. Today we will be discussing mainly the muscles of posterior abdominal wall. So mainly we have first muscle which we will be seeing is psoas major muscle. This muscle which you can see over here is the psoas major muscle. Over here above just a very small muscle but with a long tendon is lying. This one is psoas minor muscle. So two psoas muscles, one psoas major, and above to it is lying is psoas minor with long tendon but small belly. Now this one is psoas major, psoas minor, and over here just lateral to it is a quadrate shaped muscle which is called as Quadratus Lumborum. So the third muscle over here is Quadratus Lumborum. I am again repeating, we have psoas minor which is lying over the substance of psoas major muscle. This one is psoas major muscle and this one is Quadratus Lumborum muscle. This one is the medial margin of psoas major and this one is the lateral border of psoas major. And this surface is the anterolateral surface of the psoas major, which is all related to the viscera like kidney, suprarenal gland and peritoneum with extraperitoneal connective tissue, renal and gonadal vessels. So we have renal and gonadal vessels, kidney, ureter. Also we have genitofemoral nerve, psoas minor muscle is lying just above it. So these are the relation of psoas major muscle. Now coming to the origin of the psoas major muscle, we will be seeing what are the points of origin of psoas major muscle. So we discussed in the lecture also, it has 3 points of origin. So number one is anterior surface and lower border of transverse processes. See over here, if we see, appreciate, here lies the lumbar vertebrae. So this one below over here lies the sacrum, above will lie the L5, L4, L3, L2, L1. So at somewhere this level we have lumbar vertebrae. So from all the anterior surface of the transverse processes of the lumbar vertebrae on either side, right as well as on the left side. So from the anterior surface of the transverse processes of the all 5 lumbar vertebrae, the first point of origin. Then the second point of origin will be from the 5 slits, one each from the bodies. We have a body of the lumbar vertebrae. So from the sides of the body, there will be 5 slips which will give origin to the psoas major muscle. Then apart from that, we have 4 tendinous arches which are formed between the intervertebral disc extending from T12 to L5, upper border of L5 level. So lower border of T12 till upper border of L5 level, there are 4 tendinous arches which will give origin to the psoas major muscle. So we have 3 points of origin, one from the transverse processes, another from the body of the upper 5 lumbar vertebrae, and third is from the 4 tendinous arches extending from T12 to upper border of L5 vertebrae. So these are the points of origin. Now where it will get inserted, it formed a belly. Now the fibers will extend downwards. It will pass, over here we have cut the inguinal ligament. It will pass below the inguinal ligament, reach the femur, and it will get inserted with the iliacus tendon into the lesser trochanter. So medial aspect, anterior surface of the lesser trochanter, it will get inserted. So that is the origin and insertion of the psoas major muscle. Clear? So it will merge with the tendon of the iliacus muscle. So when these fibers contract, they act as strong flexors at hip joint. So when the fibers of the psoas major will act, they will act as a flexor. They will cause flexion at hip joint. Also they will provide stability at hip joint while in the sitting position. So that is a major action of psoas major muscle. Now coming to the another muscle which is psoas minor. So the small muscle which is lying over the psoas major muscle is very small muscle which is psoas minor muscle. This muscle mostly in many cases it may be absent. So this muscle may be absent in few cases. So this muscle, now it is small, it is taking origin from the T12 and L1 vertebrae, sides of the bodies of T12 and L1 vertebrae, including the intervertebral disc. So T12 और L1 की body की side से including the intervertebral disc. Now since it is a small muscle, it will get inserted into the iliopectineal eminence as well as on the pecten pubis. हमने pubic bone पढ़ी है. So it will get inserted on the pecten pubis as well as iliopectineal eminence. So that is the insertion of the psoas minor muscle. Now it may be absent in few cases. So it basically acts as a flexor, weak flexor at hip joint. So that is the only function of the psoas minor muscle. Coming to the third muscle is the iliacus muscle. We have all seen hip bone and we have studied ilium. So we studied the iliac fossa. So this muscle over here, which is originating from the upper 2/3 surface of the iliac fossa, these are the fibers of the iliacus. So this muscle is the iliacus muscle. So taking origin from the upper 2/3 of the iliac fossa and also from the inner lip. This one is the iliac crest. So inner lip of the iliac crest and also we have ventral sacroiliac ligament and iliolumbar ligament. So ventral sacroiliac ligament as well as from the iliolumbar ligaments, the fibers will take origination, and also the upper surface of lateral part of sacrum. Over here lies the sacrum bone. Sacrum bone के lateral surface से भी कुछ fibers originate करेंगे for iliacus muscle. So 3 points of origin. One is from the iliac fossa, upper 2/3 surface. Then second is the ventral sacroiliac ligaments and the iliolumbar ligaments, and the third is the lateral surface of sacrum. Now the fibers, again we have discussed that it will merge with the iliopsoas tendon together with the psoas major, and it will get inserted on the lesser trochanter. Plus इसके fibers 2.5 सेंटीमीटर नीचे तक extend करते हैं from the lesser trochanter of femur. So the fibers will extend downwards 2.5 centimeters below the lesser trochanter on the surface of the femur. So this is about the iliacus muscle. Now what is the action of iliacus muscle? Along with the psoas, it will act as a flexor at hip joint. So iliopsoas tendon all together, it will act at the hip joint and will cause flexion. Now the last muscle which is left is the quadratus lumborum. You can see this muscle, it is quadrate shape. Over here we have, see, this one is the iliac crest. This one is the ilium bone. This one is the iliac crest. Now this is the only muscle in the posterior abdominal wall whose origin is occurring from the downwards and insertion is occurring upwards. तो ये नीचे से ऊपर चलती है. The muscle is taking origin from the iliac crest. So first point of origin which we will be studying, the first point of origin is the transverse process of L5 vertebra. यहाँ पे at this level is lying the L5 vertebra. So transverse process of L5 vertebra, it is taking origin. Then we have iliolumbar ligament. Second point of origin is the iliolumbar ligament, and the third point is adjoining 5 centimeter of the inner lip of the iliac crest. We have inner lip of the iliac crest. तो इसके adjoining 5 centimeter they will take origin from the adjoining 5 centimeter of the iliac crest. So 3 points of origin for the quadratus lumborum. Number 1 is the transverse process of the L5 vertebra, then iliolumbar ligament, and then finally the adjoining adjoining 5 centimeter of the inner lip of the iliac crest. Now fibers will start extending upwards. ये ऊपर की तरफ move करना शुरू कर देंगे, and simultaneously they will keep on giving slips to transverse process of L4, L3, L2, L1. ठीक है? So that will become the insertion. The fibers will they will get inserted by giving slips to the transverse processes of L4, L3, L2, L1. So that is the insertion. The rest, the fibers which are left now, they will get inserted into the 12th rib, anterior surface, lower border. So rest, the fibers which are left after giving slips to the L4, L3, L2, L1 transverse processes, the rest of the fibers will get inserted into the 12th rib, anterior border, lower border, anterior surface. So that is the point of insertion of quadratus lumborum. Clear? So altogether, what will be the action of this muscle? Since it is getting inserted on the 12th rib, and it getting inserted on the 12th rib, so it will fix the last rib during inspiration. So it will fix the last rib during inspiration so that diaphragm can contract effectively at this point of time. At the time of inspiration, diaphragm can contract effectively. This one is the diaphragm. So at the level of, since it is getting inserted at the 12th rib, so it will help the diaphragm to contract effectively at the time of inspiration. Now when one side, जब एक side की quadratus lumborum contract करेगी, it will cause lateral flexion at this trunk level. So when it contracts on the one side, it will cause lateral flexion. When the both side quadratus lumborum contracts, it will help in maintaining the extension of at this trunk region. So it will keep this trunk region in extended position when the two sides of the quadratus lumborum contracts all together. So that is the muscles of posterior abdominal wall. We studied psoas major muscle, we studied psoas minor muscle, we studied iliacus muscle, and we studied quadratus lumborum muscle. Psoas major will be supplied by the spinal nerve, that is straight away the branches will come from the roots of spinal nerve from L2, L3 and L4. L2, L3, L4 की roots जो हमारी spinal nerves की emerge करती हैं, they will supply the psoas major muscle. Psoas minor, it will be supplied by the root coming from the L1 nerve. Iliacus will be supplied by the femoral nerve. Femoral nerve is this one is the femoral nerve. So before entering into the thigh region, it will give one branch to iliacus muscle and it will supply the iliacus muscle. And quadratus lumborum will be supplied by the spinal nerves T12 to L4. जहाँ जहाँ ये इंसर्ट करती जा रही है quadratus lumborum, वही उसके ventral rami spinal nerves के वही सप्लाई कर रहे हैं. So T12 to L4 ventral rami spinal nerves will supply the quadratus lumborum muscle. Here, now one important applied aspect of the related to this psoas region is the formation of psoas abscess. Now see, this one is the psoas major muscle. It is enclosed in a fascia, and that fascia is called as psoas fascia. So if you can see this one, this fascia is called as psoas fascia. So this muscle is enclosed in the fascia, which is called as psoas fascia. अब ये जो fascia है on medial side, it merges with the body of the all 5 lumbar vertebrae. ठीक है? So this fascia on the medial side is merging with the fascia of all the 5 lumbar vertebrae. On the lateral side, it is merging with the anterior layer of thoracolumbar fascia. एक fascia होता है which is covering the lumbar region as well as from the thorax region. So that fascia is called as thoracolumbar fascia. So on the lateral side, it will be merging with the anterior layer of thoracolumbar fascia. Superiorly, it will extend and it will form the medial arcuate ligament. This one. So superiorly, it is extending and forming the medial arcuate ligament, extending between the body of L1 vertebra and transverse process of L1. Extending between the body and transverse process of L1 vertebra. And inferiorly क्या कर रहा है कि it is fusing with the fascia of iliacus. This one is the iliac fascia. So it is fusing with the fascia of iliacus. And we know that iliopsoas tendon will get finally attached in the femur. Now what happens if there is any tubercular infection, tuberculotic infection अगर हो जाए in the lumbar or in the thoracic vertebral level की region पे, then what will happen, that infection can traverse and it can form a swelling in this femoral region. So this is important from that clinical significance. Clear? So that is all for the muscles of posterior abdominal wall. Next topic which we are discussing is the lumbar plexus, followed by diaphragm.